So I'm Mayralis De Jesus. I want to introduce myself first, and then I hope everyone's doing well. And thank you for being here. I know this is very different that we're used to, being with each other, but now we have to get used to this technology, and we're thankful for that, so we can interact a little bit. I am from Puerto Rico. I am a family medicine doctor. I went to med school in Guadalajara, and then I came to San Antonio to do my residency, my family medicine training here, and that's how I ended up working here, and I currently work at WellMed at Greenway Park. I started recently, about like 3 months ago, and then this all happened, but we're happy seeing patients over there and adjusting to these telemedicine visits and all that's new with this pandemic. But I hope everyone's doing well. And then I'm gonna be talking today about the kidneys, a very, very important topic. So I'm not gonna be too specific. I'm gonna more like be, a general approach to it. So we're gonna talk about what are the kidneys and what do they do in your bodies. And then we're gonna discuss how we check the kidney function, discuss the chronic kidney disease and the stages, and then how to prevent and treat the kidney disease. So it's a very, very good topic. So what are the kidneys? There are two bean-shaped organs that are about the size of a fist. They are the primary filtering system for our bodies, and it filters about 150 liters of blood per day. And the main function is to remove waste products and then fluids too in the form of urine. So here we have the kidneys. You can see both of them on the top part. Actually, the left one is always a little bit higher. And then we see coming down from each kidney 2 tubes or pipes. They connect to the bladder, and that's when we hold the urine. And then the urethra is the one that takes the urine outside of our bodies. So really nice. Usually the kidneys are localized more towards the back. That's why some people, sometimes when you have back pain, they think it could be the kidneys, and actually it could be because they're more towards the back side of the back. And then here you can see them in a closer look. It's a very, very nice system that we have. It's amazing how well they keep everything. They have these little tubes inside, and they clean things like from the blood in and out some little vessels, and then the urine gets collected in some tubes, and then that's what comes out. But it's a really amazing system how all that happens. So think about like our filter in the fridge, in the car. It's like this one is even much better. Like we have to take care of it to keep it, functioning well. So the major function of the kidneys is to maintain balance in the body. So it, like it says later, it says balance electrolytes. So basically it's maintaining a good level of all the electrolytes in the blood, your calcium, your sodium, everything gets filtered by the kidneys. So basically that's what maintains all that levels good in the blood. And then it's very critical also to maintain blood pressure. We don't think about it like that, but actually it's the one that's keeping the blood pressure checked. So when it's high, it can cause some changes, and otherwise we'll talk about it in a little bit. And then after all this happens, then that's how the urine gets produced and expelled out of your body. So whenever we can have two different issues with the kidneys. They're called acute or chronic. So acute is anything that happens from, short time. So for example, we are monitoring your blood and your kidneys are fine, and then next week you go to the hospital and they check your kidneys, and actually they see that the function is worse. So that is called acute because it's been less than 3 months. And usually that's caused by things that can be addressed right there. For example, dehydration is a big one. If you're having vomiting, severe diarrhea, you're losing a lot of water, fluid, electrolytes, and then the kidneys struggle a little bit more, and that's why you get IV fluids, and we want you to stay hydrated when you're sick. Another big one is kidney stones. They can block the urine flow, and then they can cause like backup of the fluid, and that can also cause some kidney issues. Usually those tend to be reversible, so once that's fixed, we have the kidney goes back to how it was before. And then we call it chronic kidney disease whenever the change in the level of your kidneys been going on for more than 3 months. And that can happen due to medical conditions, medication. Some medication can cause acute damages or changes, and then others can cause over time chronic changes. So this happens more slowly. And then the problem with this is that when the kidney starts to get worse, then it's harder to remove the waste, all the things that need to get out of our bodies. So then waste start to accumulate in our system. And that's when you start feeling sick. Usually that happens when the kidney has been very bad for a long time, or when it's already a later stage. We'll talk about that in a little bit. And then since the kidney filters all our blood, then every little change, can affect every organ in the system, especially the heart, the brain, our blood vessels, and all that. So it's very interesting that only about 10% of people that have chronic kidney disease actually know that they have it. That is a combination of things, because sometimes we as doctors, we know that your kidneys are starting to change, but for example, we have stages and we don't tell you right away when it's stage 1 or 2. For example, some people tend to tell you when it's already more like stage 3 and things like that. So I think that could be contributing to that low number, or sometimes you're not aware, but we're actually doing things about it. But that is very interesting to me. That's why I think it's important this talk too. And then from the chronic kidney disease, you can have changes in blood pressure. You can develop anemia. You can get low hemoglobin or low blood count. Why? Because the kidneys are actually in charge of producing hormones that keep your hemoglobin levels good, and also hormones that keep your bones in balance too. That's why it can cause weak bones or poor nutritional health, and even nerve damage too from all the electrolyte changes and all that. So over time, it can cause a lot of things. And then once you have kidney disease, then you're at increased risk for having more like heart issues and blood vessel disease. And that's why it affects like the places that have very small vessels, for example, the brain, the heart, and then the kidneys itself get more damage, and the nerves, because they have very, very small vessels. The same with diabetes. And then these problems, tend to happen over time. It's not that you have chronic kidney disease and then next day you get them. It's more like over time if they keep worsening. And then the chronic kidney disease can also cause diabetes and other disorders. So it's very interesting because it's like a two-way road. So high blood pressure can cause chronic kidney disease, and then chronic kidney disease can cause high blood pressure. The same with diabetes. It's like more like once you have diabetes, we have to make sure the kidneys are good because they can get more damage from the diabetes. So it's kind of like one or the other. We never know which one came first, but usually that's why every visit we monitor your blood pressure and these blood levels that we're going to talk about. So higher risk factors for developing chronic kidney disease are if you have diabetes, if you have high blood pressure, if you have family history of kidney disease already. Sometimes some things are hereditary, age 60 or older. And then the race, African American, Hispanics, and Indians are a higher risk as well. And then using NSAID frequently. So this is very important. Ibuprofen, naproxen, diclofenac, or Aleve, Motrin are the medications that usually after 60 or so, I start telling my patients, only take it if needed and for a very short time, because if you keep taking them, every day, 3 times a day or twice a day for months, they affect your kidney function. So after you are 60, I would say try Tylenol, Panadol, acetaminophen first if your liver is good, and then go to these ones because over time they do affect the kidneys and the stomach and other things. And then the history of acute kidney injury, the history that we talk about when you have acute changes, having that multiple times, even if the kidney recovers, sometimes that makes your kidney over time develop the chronic kidney disease. So it is important to know about it because it is silent. We're gonna talk about some symptoms that you can have when you have it, but they're not always there and they're very not specific. So that's why we as doctors monitor it very closely. So the early detection and treatment are essential to making sure that it doesn't get worse over time. And then that keeps your quality of life and better outcomes. And then if your kidney is worsening, then it can develop to the point that is called end-stage renal disease, and that's usually stage 5. We're gonna talk about it in a little bit. And that's when you require hemodialysis to clean the blood from you because your kidneys are not doing the work, so you need something from the outside to actually clean it, because if not, you cannot stay alive. It's very important to maintain this balance. So possible symptoms, I say possible because really they're very non-specific symptoms. You can have these symptoms with a lot of other diseases, but you can see them with kidney disease, chronic kidney disease, especially at the later stages. So for example, feeling tired or trouble concentrating, and usually this is a result from the anemia that you develop from having the kidney disease or trouble cleaning the waste from your body. And also trouble sleeping, because you can develop sleep apnea from the kidney disease as well. You can have dry and itchy skin from also mineral imbalance. And then you can see that sometimes you're urinating more often. At the later stages, actually, when you're almost at the hemodialysis point or actually getting dialysis, you actually don't urinate at all or barely urinate. But at the beginning, you can have more like need to urinate. And then also sometimes you can see blood in the urine. Another good one is foamy urine. So foamy urine is usually related to the amount of protein in the urine. So some people, like if you urinate and you see a lot of foam, and then it could be, changes. Sometimes you can have more protein than others, but if you see it all the time and then you flush it and the foam is still there, it could be that you're putting a lot of protein in the urine, and we're going to talk about that regarding the kidney function as well. And then puffiness around your eyes. That happens because when you're putting the protein in the urine, then your blood have less albumin, and the albumin is needed to maintain the balance between the fluid and the swelling and all that, so you can develop that swelling. And then also around the feet and ankles, you can have swelling because of the sodium retention. So sodium's being retained, and then the water follows to keep the balance, and that's when you get the swelling. And then poor appetite, and also muscle cramps from high electrolytes in the blood, like calcium or potassium or something like that, or low magnesium something. So how do we monitor the kidney function? How do we know what's going on? So usually in the annual checkup that we do for every patient that we see, there's something called, we have two, that they have the comprehensive metabolic panel or the basic metabolic panel, and that one checks the creatinine in the blood. And then it was already in the result, it comes with a GFR. So the GFR is the glomerular filtration rate. That it's calculated using, actually the system does it by itself. It uses your gender, age, weight. I don't think they use it as much because they don't know everyone's weight. And then the race is actually tells you non-African American and African American, because it changes a little bit on that. So every panel that we do automatically tells us the glomerular filtration rate. We also have other equations that if we are we're like, we want to know for sure, since it's not using your height and weight, we can input your numbers in other calculators that will give you sometimes more accurate filtration rate, because the one that is automatically calculated sometimes don't take into consideration weight, height, and all that, and that is important too. So like I said, we check that at least once a year if you're really healthy. And once you have all the medical conditions, usually we check it every 3, 6 months, even every month, depending on where you are and what medical conditions do you have. And then apart from checking that in the blood, that is a blood test, we also check a urine sample. So usually when you go to the doctor and you give a urine sample, what we're measuring there is the microalbumin creatinine ratio in the urine. Sometimes we can check for other things like blood, white cells, infection, things like that, but this test is different. We have to do it at least once a year to see how much protein you have in the urine. Normal, you know, if your kidneys are functioning well, you should excrete less than 30 microalbumin creatinine ratio in the urine. If you're 30 to 300, we're like, okay, something's going on. We have to make sure blood pressure is good, your glucose, you know, your sugar and all that. And then more than 300, we're like, okay, that's a lot. We have to do more things. So to usually, for example, so it changes depending, you know, what you've been doing lately. So we need actually 2 urines with more than 30 or more than 300 to actually call it like, okay, it's something's going on. So we have to repeat it in like 3 months or 6 months again to make sure it's actually nothing that is transient or temporary, something that is actually causing changes. The same with the blood. So usually if we check something comes up, okay, your kidney function is worsening, we have to repeat it in 3 months to call it chronic kidney disease, because we have to have that. It's not something, okay, it just happened one time, it got away, then it's fine. And then these both tests together are the ones that give us, you know, more information about what could be going on in the kidneys. So it is very important also that the normal filtration rate is age related. So they said that after 40, your functions start to come down about 1% a year. So I call it percent because actually the number here, as you see, is like milliliters over minutes, but you can call it by percent because actually it's about 100, like 90 or more is normal. So for example, if you are 80-year-old, after 40, you start decreasing 40. So if normally it's like 100, then that's why at 80, you're okay if your kidney function is 50 to 60. That is an expected change with age. And we're gonna talk about the stages. And if you see the stages, it's gonna be between stage 3 or 2, so it's kind of like right there, but still is something that is, you know, with age, it can happen, and sometimes with the weight and all that. So here is like a little chart that it tells you on the left, like the numbers that are like usually above 100, you see when you're really young, and then as you age, it starts to climb a little bit. So that's why if you're 80 and it's like 60, we're like, okay, you're CKD stage between 2 and 3, but we're gonna monitor it. So we're gonna talk about that a little bit now. So we have the stages. That's how we classify where you are. And we use 2 things. So on the top, you see there that it says albuminuria, and stage A1, A2, A3. This is actually the graphic that I have in my wall to follow where you are. So that is regarding the urine test, the one on the top. So you see less than 30, normal. Then we have the second category is 30 to 300 is the okay, let's watch it. And then the third one is the more than 300, and usually if it's like that, we will send you to the kidney doctors to be evaluated. And then on the left, that other column has the stages. So if you see G1 is the stage 1 is normal filtration rate, and it's more than 90. So more than 90, it's normal. And then between the 60 and 90 filtration rate, then you're on the stage 2. And then once you go to the stage 3, we have A and B, because they usually like to monitor more closely the stages B, because you're closer to get into the stage 4. So that's why we have A and B. So after, when your filtration rate is lower than 30, it's called stage 4. And that's when usually you are already seeing the nephrologist, the kidney doctor, and usually they're talking about, let's prepare for possible dialysis, because once you get to less than 15% of kidney function, that's when usually you're already needing dialysis. Not everyone is the same. So I do have some patients that are like 17, 18, and they're not in dialysis, or they haven't even started talking about it, but usually at least you should be seeing the kidney doctor. And sometimes for dialysis, they need to do procedures in your arms. It's called like a fistula, to actually get the blood in and out. So they start getting you ready for that. Even if you never do it, at least you're ready in case it needs to be done. So this is actually the most important chart, I think, because what I do is, like, if I see on the red, all the reds, I will for sure send you to the kidney doctors. And then the yellow, it's kind of like, if I feel comfortable, I will keep an eye on it in my office, checking more regularly and controlling other things, but we don't have to refer you. It's more like close monitoring. So, and the green, we're good. So it's a combination of both things about, the protein in the urine and the blood. And that's how we calculate, the stages and what we need to do about it. Some people think that whenever I send you to the kidney doctor, you're gonna get a pill to actually make your kidneys better, but that is not the case. I wish we have one, but actually what we have to do is control all the things that are causing the kidney to get to that stage. Some people is because they're taking ibuprofen, naproxen every day, and we can just stop a dose and change it for another medication, and then your kidney, starts to get better slowly. Others, are not drinking enough water, blood pressure is high. So those are the things we have to do. But we send you to the kidney doctors because they also help us with dose management, and also they do, for example, usually when we send you there, we get an ultrasound of your kidneys. We want to make sure you're not having a big stone that could be removed and then you're gonna get better, or that you don't have a lot of cysts in the kidneys that actually they can biopsy and see what's going on. So we do have different things that can happen, but it's not like we can give you a pill to make it better per se. It's more like everything else. And then this one doesn't look too good here, but it's a good one about, the symptoms. Usually like stage 1, 2, and even 3, it's like you don't even get any symptoms. And then usually at stage 4 is when you can start having some symptoms depending on the level. And then stage 5 is when they can no longer keep up with all the cleaning and you're actually needing hemodialysis, okay? So knowing these numbers are the ones that, like I said, is gonna tell us what to do next. And usually we recheck it at least every 3 or 6 months to see the changes. So if I tell you, okay, stop the medication, let's adjust this, adjust that, then we will recheck it usually in 3 months. If it's too bad, then it could be earlier. And then usually your doctor should be able to monitor this and discuss it with you and make a plan. And like I said, nephrology referral when needed. The complications are anemia. As I said before, low hemoglobin, and that's when usually the kidney doctors are already seeing you because they can give you injections to raise something called erythropoietin injections, and they do actually raise your hemoglobin levels. And then also they check other hormones like parathyroid to make sure you don't develop bone disease. So usually the nephrologists where the kidney doctors are the one managing all those complications from the kidney disease much better than us. And also we want to make sure your potassium is good, because when your kidneys are not working well, you can develop very high potassium, and that can actually worsen your heart or cause like a heart attack or something like that. So it's something that we monitor. And then our goal is really to slow the progression of the disease. So if we know we're stage 2, 3, we just want to make sure we don't keep worsening and get to a 4 or 5. And then of course treat the possible causes like the kidney stones, and then the medications. Sometimes some medications can cause it. For example, if you're in the hospital and you have a really bad infection, they can give you IV vancomycin, and that antibiotic is very strong on the kidney. So we have to monitor the levels and make sure we don't damage your kidney. So a lot of medications are like that. When you have chronic kidney disease, we have to adjust the doses to avoid getting the kidneys more damaged. And then if you have an enlarged prostate, that can actually also cause like an obstruction and get like the backup of the urine. That can also cause kidney changes. If you have autoimmune diseases like lupus, if you have infections or inherited conditions, then that's what we want to treat. And then treatment per se, like I said, there's not like a pill, but at least if you are overweight or obese, losing weight always helps everything. So it's kind of like losing weight helps, and then cutting down the salt on the diet, because like I said, then the sodium goes up and then you retain more, the salt goes up and then you retain more water, you develop the swelling. So cutting down the salt helps with that swelling and controlling the blood pressure. So it helps a lot. And then if you have diabetes, making sure that A1C, is below 8 for sure, making sure that morning fasting sugars are about 130 or less, that helps a lot too. And then avoiding the anti-inflammatories, like I said, ibuprofen, naproxen, all of those. And then some people think that everything that is over the counter is good to go, but we actually need to make sure, since they are not monitored, they're not regulated by the FDA, we don't really know what it's in there. So sometimes it can damage the kidneys too. And I see it more often with the liver, but I guess it can happen with the kidneys too. We just don't know it. And sometimes that's why when you go to the doctor, you should tell them everything you're taking, because sometimes like, you're taking this every day, your kidneys are worsening, let's just stop that and see what happens. Maybe it was just from that, and that can help a lot. And then if you're smoking, of course, stopping smoking helps. Exercising, being more physically active, that helps. This one, ACE and ARBs, this one is very interesting. So a lot of people, I've noticed that the doctor start them on a medication, like for example, lisinopril, enalapril, or losartan, valsartan. We have a lot of those, olmesartan, telmisartan. And they think, they're like, no, I'm not taking it because my blood pressure is fine. So I don't need the blood pressure medication, because when you look for the indication, that medication is to lower blood pressure. So actually we do it to help your kidneys, because how those medication works, it improves the blood flow to the kidneys. So it can actually make it better. So always, I try to tell my patient when I started, it's not for your blood pressure, it's for your kidneys. Usually we do a very low doses because we don't want to lower your blood pressure too much, but we just want to improve that blood flow to the kidneys. So before you stop any medication, just ask, why am I taking it and all that, because it could be more for a prevention, just to lower that protein in the urine, just to help the kidneys. Sometimes this medication can actually make the kidney worsen. So that's another big one. That's why when we start medication, usually we check more blood levels later to make sure we didn't cause more trouble, because it can happen. But sometimes when they worsen just a little bit, it's expected, and then it should get better over time. And like we said, treating the underlying, anemia, bone disease is very important, and then adjusting medications. So insulin is a big one. Once you are stage 3, 4, usually, since the kidney cleans everything, what happens if you are injecting insulin every day, and it's not being cleaned really well, the insulin levels start to go up. So you start having low sugars, and it's actually happening from because of the kidneys. Then the insulin is more in your blood, and then it gives you the low sugar. So when your kidneys are struggling, usually we start to come down on the insulin. It depends, because I know it's a hard one. If your sugars are really high, we want to control it, but sometimes we can use other medications rather than insulin, just because it can accumulate. But those are usually more like later stages too. And then metformin is a big one. I know everyone that's pre-diabetic or diabetic are usually on metformin, and that's another one that we can potentially have the dose or even stop it after, stages 3B or 4. We have to look on that one too. And the same with a lot of medications, antibiotics and all that. We always have to, it's called renally dosed medication. So whenever we're gonna start something, we have to see your kidney function and actually give you the right dose, because it can be too much for you, because it will stay longer in your system. And then, of course, avoiding medications that worsen the kidneys, like we said before, the anti-inflammatories or pain medications, or very strong antibiotics that can worsen it. So from all this talk, I feel like I've been talking a lot. The important thing is to know your numbers. I know we don't always ask our doctors, or sometimes we're just so busy that we don't tell you, but ask them about your kidney function. We know it for sure, believe me. So it's more like asking the question, do I have protein in the urine? Do I have things like that, that sometimes it's just a little bit, we might not tell you, but it's good to know for you, for yourself, because maybe you're like, okay, I'm gonna work much better on my sugar, on my blood pressure, exercise, or you can get motivated because you know that eventually it can cause some damages. And that's it.